Dr. Ramasamy is a good friend of ours. He's been supporting the drive for many years now. And as you know, in the drive, we try to educate men on new things that may be on the horizons, especially things that they worry about the most, which would be erectile dysfunction. Now, that's a pretty big problem out there these days, right?
100%. I mean, 1 out of 2 men above the age of 50 have erectile dysfunction.
So one of us, when
yes,
we're 50.
After we turn 50. So we may run into the trouble. For now, I think we're okay. But it's still, no, it's a very common condition. And it's a very distressing condition. It's a very embarrassing condition. Patients often do not want to talk about it. And it's important that you are bringing awareness to this condition, to men, that it's an okay issue to talk about, to discuss both with your partner as well as with your physician.
Mm-hmm. So when you see these patients in the office, there's obviously an evaluation, and then you usually offer them some treatment options.
Correct.
What are those general treatment options that are out there for men?
So the current FDA-approved treatment options for erectile dysfunction are basically PD-5 inhibitors, which are pills such as Cialis, Viagra, and Levitra, and Stendra. And if men don't respond to pills, then there's something called injections, which men can use on their own inside the penis to try and get an erection and maintain the erection. And if that doesn't work, or men don't want to try that, then there's something called penile implant, which is a surgery treatment option for erectile dysfunction.
Mm-hmm. What about those suppositories? People still use those, or?
They're unfortunately not used as much. They're used in sort of a rehab way to sort of maintain penile length in men who've had either radiation for prostate cancer or surgery for prostate cancer. It's very rarely used as a primary treatment for erectile dysfunction. But you're right, that is also an FDA-approved treatment option.
And then the vacuum erection devices as well, like we see in Austin Powers. That
Correct.
I know, I see a lot of patients buy those online.
Yes, yes. Unfortunately, the vacuum erection devices are cumbersome. The compliance is poor, and the efficacy is also poor. So after 6 months, unfortunately, 20 to 30% of them actually end up using it to get an erection. Again, I think vacuum erection device is most likely used in the rehab setting to sort of maintain penile length and to maintain blood flow to the penis. It's very rarely used as a primary treatment option for erectile dysfunction.
Okay. So one of the new treatment options that we see is shockwave therapy. There's a lot of buzz about it. We've heard a lot about it from you and your team here at the conference. Can you tell us a little about what the technology is and what benefit it may show for patients?
Sure. So shockwave therapy is a form of ultrasound waves. So these are high energy ultrasounds that are delivered directly to the penis. Of all of the treatments that we spoke about, they all help to sort of treat erectile dysfunction, right? They don't really address the underlying problem. They don't address to cure erectile dysfunction. Shockwave therapy is in a way to try and change the pathophysiology of erectile dysfunction, to try and potentially offer a cure for erectile dysfunction. It's important to know right off the bat that it's still not FDA approved. It is approved for use in Canada, in a majority of the South American, European countries. It's approved for use in Asia as well. So in the United States, we at the University of Miami are actually doing a clinical trial to try and submit some of the data to the FDA to try and see if we can get it approved. Now, the way the technology works, it's an office-based administration of these shock waves. Men don't need to take pain medications, they don't need anesthesia, and it takes about 10 to 15 minutes in the office to offer this therapy.
So is it like the ultrasound that you do of your belly or your penis, or is it like a different kind of way of doing it?
It's exactly very similar. So there are a few machines out there, one which offers it with a probe, which can be placed on the penis by the operator, or machines in which the penis gets attached to the actual device. And
we saw some devices here, like you sit down on it and the penis.
Correct.
And it looked very interesting.
Yes, no, I mean, it looks scary. I mean, the first thought of shock and the word penis being used together, men often get very scared because they think that they're getting tied down and their penis is getting shocked, but it's really not that. They tolerate it fairly well. They, like I said, they don't need any numbing cream, no pain medicines, and it's only 10 to 15 minutes.
Really?
And we do it in the office once a day for about 5 days, and we have very good results.
You presented some of that here. Do you mind sharing?
Yes, so we have recruited a total of 90 patients so far at the University of Miami, and now we have data on about 60 patients at about 6 months. And at 6 months, we can tell that at about 60% of men are able to have erections and are happy with their erections without Cialis and Viagra.
Really? Okay.
And I think that's what's very important, because a lot of the trials and a lot of the companies that are using shockwaves use it concomitantly with Viagra and Cialis, and so you don't know which one's working. Is it the Viagra and the Cialis, or is it this, or is it the combination? And so it's tough to tease it out. But with us, you can't take any Viagra and Cialis, and if you do, we drop you out of the trial.
Oh, okay.
And so that 60% data is basically men who are not using Cialis and Viagra at the end of 6 months.
That's fantastic. So when do you see it getting FDA approved?
So I think it's probably going to take at least another year or two before it gets FDA approved. And but once it does, I think it's going to change the face of treatment of erectile dysfunction.
I think that's exciting. Now there's some other things that we always hear about: plasma therapy and stem cells and all that stuff. What?
So those is the PRP, is the platelet-rich plasma, and stem cell injections inside the penis. All of these are sort of restorative therapies for erectile dysfunction. We're trying to restore erectile function as opposed to just treat erectile dysfunction in men. Unfortunately, compared to shock waves, the data with PRP as well as with stem cells are very little. There are very few randomized trials, there are very few safety studies, in fact, using these, and so therefore patients have to be very careful before they try and pay cash basically for these therapies. FDA now has a huge oversight on stem cell clinics. They're sort of clamping down on many of the stem cell clinics because it's just the practices are bad. And so patients have to investigate, make sure that they are getting what they are told, and hopefully there's some sort of value in the money that they end up paying.
And I think this segues into a great point, is that don't go directly to some hype that you may see. There's lots of things you can do in the middle. See your primary care doctor, see your urologist, see your sexual health expert first. And I think a lot of men are just bypassing that. So don't go for the easy route because you think it's easy and it's on some billboard. Go and see someone that's trained in this.
100%. I mean, unfortunately, erectile dysfunction is such a common and embarrassing problem that men are willing to do anything to get their erections fixed. And some of these advertising campaigns surrounded around an easy fix, it's just never easy. And if you get taking the easy route out, there must always be something in fine print that we're missing.
But there are some easy things guys could do right now, watching this at home. 3 things that you would recommend they can start doing right now to help their erectile function now and to avoid having issues down in the future.
Right, so I think the major correctable causes for erectile dysfunction are guys that are smoking. You just got to stop smoking.
Does that include vaping as well? Or?
Absolutely, yes. And because all of that affects blood vessels throughout the body, and if blood vessels are affected to the penis, that's what erectile dysfunction is. And the other is weight loss. Being on a good diet, and I think all of that will certainly help with maintaining your erections. And finally, if you're diabetic, make sure your blood sugars are under control, because the longer you have poorly controlled blood sugars, the greater the chance of developing erectile dysfunction and worsening erectile function in the future.
So if you want to have good sex in the future, start thinking really hard about what you're eating now and make those better choices.
Absolutely.
Awesome, man. Well, thank you very much, Ranjith. Appreciate your time.
Hi, I'm Dr. RanjithRamasamy. It's time to drive for men's health.